A major milestone in neurosurgery. Hartford Healthcare performed its 500th transnasal skull-based surgery this September. Joining us to tell us more about it is Dr. Belachew Tessema, Associate Director of the Hartford Hospital Ayer Neurosciences Institute Skull-Based Surgery Program. Dr. Tessema, thank you for being with us.
Thank you for having me, Kara.
Yeah, good to see you again. But tell us and our viewers, what is it? And what makes the 500th transnasal skull-based surgery so significant? A lot of folks may not know what that is.
So reaching the 500th transnasal endoscopic skull-based surgery is a powerful milestone because it highlights both the depth of experience and the trust patients put on the Hartford healthcare system. Very few centers in the region match this level of volume, which translates into refined endoscopic surgery skills, strong outcomes, and even national recognition. It shows that patients are being treated with a program with proven expertise, advanced technology, and track record safely handling some of these really complex skull-based problems.
Yeah, tell us exactly what it is and how it benefits patients at Hartford Healthcare.
So transnasal endoscopic skull-based surgery is a minimally invasive approach where a surgeon accesses the skull base through the nose rather than making a big incision in the head. So at Hartford Healthcare, this technique means that patients have less pain, shorter recovery, no facial scars, even faster return to their activity of daily life, which is a great thing. But it also affords the surgeons to have precision and safety treating these complex problems.
Yeah, and I mean, it really involves a big team. How does the collaboration between neurosurgery, ENT, and oncology at Hartford Healthcare all impact your patients' care?
Kara, you're so right. This is truly a team-based program. Neurosurgery, ENT, like you said, oncology, and even endocrinology and ophthalmology all come in side by side working with patients from their diagnosis to treatment. So these are complex conditions like tumors, pituitary tumors, which necessitate a coordinated treatment plan and blended expertise in surgery, advanced imaging, cancer care, hormonal treatments, right? So this results in safer surgery, more complete tumor removal, preservation of vision and function. So it also gives patients a smoother experience with specialties aligned with the same goal and the best possible outcome for our patients at Hartford Healthcare.
Yeah, great to have such quality care right here in Connecticut. Dr. Belachew Tessema from the Hartford Hospital Ayer Neurosciences Institute. Thank you so much for being with us. And you can find more information at hartfordhealth.org/neuro.